Hello everyone, my name is Lauren Schnack. I am Dr. Rodriguez's current fellow for the Complex Deformity Correction and Limb Reconstruction Fellowship at Amita Health, St. Joseph Hospital in Chicago. I am with Dr. Deval Patel, the incoming fellow to the North Jersey Reconstructive Foot and Ankle Fellowship under Dr. Subik, and we are discussing learning the operative microscope. Some tips for learning the OR microscope is do not slouch while you're using it. Do not hyperextend your neck and just get comfortable and be in a relaxed neutral position. Ensure that your arms are in position with stacked towels for easy wrist movements, and ensure that your back is on the back of the chair, or use some blankets or pillows for some support. And just to remember, this is in conjunction with, you want to introduce a microscope when the loops in the headlamp that you're using are not enough. So you can have loops, with oroscopic that go up to 5 times magnification, and the OR microscope can go up to about 10 or 11 magnification, and becomes more useful when you're looking at peripheral nerves and pedicles for flaps. What about positioning? So you want to make sure that the microscope itself is in a good position between possibly the OR bed and the door, but so that it doesn't interfere with the patient or the door opening. And you want to really adjust the base so the bed is between the door and it's pointing towards the operative field. Always use the handle to push it to where it needs to be, and note where the light source is. So this would be the first thing to address. It's on the back bottom area of the microscope, and that the cable must be plugged into the microscope. So you flip the switch, make sure it's plugged in, and if the light doesn't go on, there's always a backup light source. So there is a little compartment that you flip open underneath it, and there is the backup light source for the microscope, and you just have to make sure that that is turned on, or else you really cannot see anything through the microscope. What about setting up the surgical field? What is everything, and what do you need? So we really want the microscope about 12 inches, about a foot or less off of the operative field. And really, this is important, because you want to be able to see what you're looking at, and you want to get the best bang for your buck out of using this microscope. Otherwise, you would just go back to using loops. So we really want to get the best magnification here. And then intraoperatively, you use sterile towels to pad your wrists and elbows for comfort, and just make sure you're in a nice relaxed position. And there's also hand controllers. So for example, if you're right-handed like myself, you would have the right-handed hand controller up and out of the way, because you would be using your right hand for surgery. You would be using your instruments with your right hand. The left hand, for example, you would have the hand controller down and ready to use. Also, you want to clean off the lens before and after use with an alcohol swab, and you really want to adjust the lens as well, but adjust them in conjunction. So either they both go clockwise or counterclockwise to better sharpen the image. And definitely adjust the pupillary distance. This is also one of the first things you want to do with the knob right there. And you want to make sure that both of your eyes can see into one circle, and that would be the correct pupillary distance for yourself. There are a few knobs that we don't want to touch, and if you do touch them, they will disassemble the microscope. But 2 things on the side of the microscope are the light collimator and the sharpener. So the light collimator narrows down and cones down the light source so you can better see the surgical field. And also you can use the knob closest to the microscope to sharpen the image. And we talked about the handle. So it has a zoom button on the outside, so it's always on the outside, whether it's for the left hand or the right hand, and the focus button is on the inside. The side red button, so in our case it's a red button, it's only for minor on the field adjustments. So you can push this button and it really only makes minor adjustments here. If you want to make very large adjustments, there's a button on the back of this handle, and it moves the entire microscope lever arm. So those are for larger movements. So once you get the microscope in place, you really don't want to use the back handle button. You want to use the side red button because you already have your microscope in place, and you only want to make small adjustments. And there's a knob that you could use to loosen this handle, this handpiece, move it out of the way and tighten it so it is completely out of your way and you're only using your non-dominant hand side handpiece. Again, there's a couple knobs that we don't want to touch or they will disassemble, but there is a shutter beneath the lens that allows your surgical assistant to see the field. So you want to make sure to slide it to the right, and so the arrows are pointing towards your assistant. So it ensures that your assistant can see what you're seeing in the surgical field. And again, it may be elementary, but we just want to make sure that the magnification is at least around 10 times, but we at least want it above 5 times magnification, because if you're doing 5 times magnification or 6 times magnification, you might as well just use your loupes and your headlamp, because you're not getting the magnification that the microscope can offer. So you really want to do yourself a favor and get at least 10 to 11 times magnification out of this microscope so it's worth your use. And there is a binaural stitch. Thank you so much for listening. We, of course, have a podcast on Buzzsprouts, and we also have an Instagram page and a YouTube channel, and Dr. Deval Patel and Dr. Rodriguez, and we are really trying to get some of these educational orthoplastic pearls out there, and so we hope you enjoy them. Thank you.